Welcome to the deep dive. Looks like we're tackling nursing assessment today. Um, you've given us a whole mix here. Textbook stuff, journal articles, even some handwritten notes.
Someone's been doing their homework.
Right. So are we prepping for a big exam? Starting nursing school? Or just, I don't know, really into how nurses think?
Maybe all of the above.
Could be. Well, buckle up because we're going to give you a rock-solid understanding of what nursing assessment really is, why critical thinking is so crucial for it, and how nurses actually use this process in different settings to, make decisions about patient care.
It's way more than just like taking notes and checking boxes.
Yeah, no kidding. It's more like detective work, right? All the sources emphasize that assessment is the foundation of everything nurses do.
It is.
They're gathering these clues, or cues as they're called, to piece together a patient's whole health story.
And what's interesting is it's a two-part process. You're not just passively collecting information. You have to interpret it, make judgments.
So that's where the real problem solving comes in.
Exactly.
It's not just data entry. It's active decision-making from the very beginning. And the sources mention different types of nursing assessments, too.
You've got the patient-centered interview. That's like a deep dive into their experience, their concerns, their goals. Then there are those periodic assessments, the quick check-ins to see how things are changing. And, of course, the hands-on physical exam where nurses are gathering data directly.
And these assessments can be super comprehensive, like covering everything head to toe, or really focused on a specific problem, right?
Exactly. Think of a comprehensive assessment like reading a novel to get the full story. A problem-focused assessment. That's more like scanning a news article to just get the key facts. Both are valuable, but different purposes, for sure.
Okay, see, this is where it gets really interesting to me, because all of this requires some serious critical thinking skills.
It's a nurse's superpower. Have you ever, when you're trying to solve some tricky problem, you think about what you already know, you gather new info, and then you start considering different possibilities?
Oh, yeah, for sure.
That's critical thinking. And it's essential for nurses, especially during these assessments.
But it's more than just problem solving, isn't it? I'm looking at one of the journal articles here, and it talks about critical thinking attitudes. Things like intellectual humility, curiosity.
Oh, those are crucial. Nurses have to be open to new information, willing to question their assumptions, always curious, right? Always learning.
So they're like lifelong learners.
Absolutely. They need a healthy dose of skepticism, too. Not to be cynical, but to make sure the info they're getting is accurate. After all, they're making decisions that impact people's lives.
Big responsibility.
Yeah.
And to do all of that, they have to be amazing communicators, right? I mean, especially thinking about that patient-centered interview.
That's where the magic happens. The nurse-patient relationship is so important.
It is.
It's not just about gathering data, it's about building trust, making that connection.
One of the studies you gave me actually found that patients who felt truly heard and understood by their nurses, they were more likely to stick to their treatment plans.
Yeah.
And they had better health outcomes. So it's not just about being nice, it's actually crucial for good care.
It makes such a difference. And nurses build that connection by really tailoring their approach to each patient. The sources highlight how important it is to consider things like age, cultural background, even their level of health literacy.
Okay, break that down for me. Health literacy, I hear that term a lot. But what does it actually mean when we're talking about nursing assessment?
It's about making sure patients truly understand the information they're getting. Some people might be fine with all the medical jargon, while others need things explained in simpler terms. So nurses have to kind of assess a patient's health literacy and then adjust how they communicate.
So they're almost like translators.
In a way, yeah.
Taking complex medical info and putting it into a language that the patient can understand and actually use to make decisions about their own care.
Yeah.
That's pretty cool. Now, the sources talk about these patient-centered interviews having like a specific structure. They mentioned these 3 phases: orientation, working phase, and termination. That sounds kind of formal.
It sounds more rigid than it actually is. Think of it like a framework that helps guide the conversation, but it's not a strict script.
So it's flexible.
Definitely.
How do nurses make sure the patient feels comfortable opening up and sharing their story?
That's where communication skills really shine. Things like open-ended questions. Tell me what brings you in today, or what's been going on with your health lately. Those get the ball rolling. Then there's back-channeling subtle cues that show you're listening, like nodding your head, saying, uh-huh.
Right.
It encourages them to keep talking. Then there's probing, gently digging deeper for more details,
So it's like anytime you're trying to have a good conversation, you get more out of people when you're truly present, listening, asking follow-up questions rather than just, grilling them. But nurses are doing more than just listening. They're observing, like a TON.
Constantly. And it's not just about what a patient says, it's their body language, facial expressions, how they're moving. Can they move easily? Are they struggling to breathe? All of that adds context.
And there's that word again, cues.
Right.
It seems like nurses are trained to be super attuned to those little details that might reveal something important about someone's health.
Exactly. And one of the sources actually mentions this PQRST acronym. It's a mnemonic device that helps nurses systematically assess symptoms. Each letter stands for a key area to explore. P for what provokes the symptom, Q for the quality of it, R for whether it radiates to other areas, S for the severity, and T for the time, course-like, how long it's been going on.
So it's like a checklist to make sure they're covering all the bases,
Yeah.
getting a complete picture of what the patient is experiencing.
Exactly. And based on all the data they've collected, what the patient says, what they observe, nurses start making what are called inferences.
Inferences. So like educated guesses about what might be going on.
You got it. But they don't just jump to conclusions. The sources emphasize this idea of validation checking their inferences against other sources to make sure they're on the right track before making any decisions.
So for example, if a nurse sees a patient who seems a little short of breath, they're not just going to assume it's because the patient's out of shape. They're going to dig deeper.
Right. They might ask about medical history, check vital signs, listen to their lungs, maybe even look at oxygen levels. It's about connecting those dots and making sure their hunch is backed up by evidence.
It's a constant cycle of gathering info, analyzing it, and then verifying it against other sources to make sure they're getting the most accurate picture possible.
That's good nursing assessment in a nutshell. And it's only the first step in a much bigger process of, planning and delivering care.
Okay, so let's say a patient has, like, multiple health issues going on at once. How do nurses keep track of all of that information?
Try to imagine holding all those details in your head. It's like juggling. That's where concept mapping comes in.
Concept mapping.
It's a visual tool that helps nurses organize their thinking and see the big picture of the patient's health.
So instead of focusing on just one symptom or one problem, they're using this visual map to see how all the pieces fit together.
Exactly. Like a mind map for patient care. It helps them see the connections between different health problems, identify risks, and start planning care that addresses everything, not just one symptom in isolation.
I'm starting to see how this all comes together. But I feel like we've only scratched the surface of nursing assessment. We were just getting into concept mapping before.
Oh, yeah.
And it sounds like a really helpful tool.
It is. Especially when you think about all the different sources of information nurses are working with.
Right.
You've got the patient's story, their medical records, what their family members or caregivers might share.
And then there's all the different test results and stuff.
Oh, absolutely.
It's a lot.
It really is. It's like putting together a puzzle, but with someone's health on the line. And you can't forget about the patient's environment, too. That plays a role.
The environment.
Yeah. Like, think about it. The sources talk about how the setting where the assessment happens can make a difference. Time pressures, interruptions, all those things can impact how much information the nurse can gather.
So trying to do a detailed assessment in a chaotic ER told me to say a calm doctor's office.
Exactly.
That makes sense. One of the articles you gave me actually highlights a case where a nurse's skepticism, her willingness to question what she was seeing, actually ended up saving a patient's life.
Wow.
Yeah, it's a powerful example of how those critical thinking attitudes,
They can make all the difference.
they really can. Nurses need that confidence to speak up if something seems off, that curiosity to dig deeper, and the discipline to be systematic, even when things are crazy busy.
Definitely. Okay, so let's talk about the actual process of gathering patient information.
Okay.
The sources mention the nursing health history. What exactly is that?
Yeah, what I said. It sounds pretty official.
It is. It's kind of like a structured interview, but with room to adapt based on the individual patient and their situation.
So not just a list of questions they go through.
No. It covers a lot of ground. It starts with basic info, like their name and why they're there, but it goes way deeper.
Deeper how?
Nurses want to understand the whole person, not just their symptoms. So the health history delves into past medical history, any family history of illness, lifestyle stuff, social support.
It's like gathering clues to build a complete picture of their life and health.
Exactly. And one of the sources makes a really interesting point about cultural competence. Nurses need to be aware of their own biases and adapt their communication style to be respectful of each patient's background,
Oh, for sure. So, like, if a patient avoids direct eye contact,
Right.
it might not mean they're being disrespectful.
Could be a cultural norm.
Makes sense. You have to be sensitive to those differences. Now, I'm looking at the section on the components of the nursing health history, and it mentions things like biographical information. That seems pretty straightforward. And then there's the chief complaint, or reason for seeking care. That's where the nurse really wants to hear the patient's story in their own words, right?
Yes. How do they describe what's going on? What brought them in today? Capturing that initial narrative is so valuable.
And it gives the nurse a sense of the patient's priorities too, right? Like, what are they hoping to get out of this visit?
Absolutely. Are they seeking pain relief? A diagnosis? Reassurance? Understanding that helps the nurse tailor their care?
Makes sense?
Yeah.
And then the health history goes into the present illness or health concern. That's where that PQRST acronym comes back, right?
It does.
To systematically gather all the details about their symptoms.
How severe they are, where they're located, what triggers them.
Okay, so we've got the patient's current symptoms, but then the health history goes back in time too.
It does.
It asks about their past medical history.
Have they been hospitalized before? Any chronic conditions? What medications are they taking? All of that is crucial.
Family history too.
Oh, absolutely.
Yeah.
Knowing about any family history of heart disease, cancer, those kinds of things, it helps the nurse identify potential risks for the patient.
So it's not just about what's happening right now. It's about looking ahead, anticipating future issues.
Exactly. Taking a proactive approach.
Right.
Then there's the psychosocial history. That seems to cover a lot.
Yeah, it does. What exactly falls under that umbrella?
Well, it's where nurses explore the patient's lifestyle, their support systems, how they handle stress, their work-life balance, things like that.
So the social and emotional stuff that can impact their health.
And one of the sources specifically mentions assessing for things like domestic violence or substance abuse.
Those are tough topics.
They are, but important. And nurses are often in a good position to identify those issues and connect patients with resources. Then there's spiritual health, too. A patient's beliefs can really influence their healthcare choices.
I'm sensing a theme here. It's like the nursing health history is really about getting to know the whole person, their individual context, their values.
That's it. It's about seeing the patient as a person, not just the set of symptoms. Okay, what about the review of systems? Have you gotten to that part?
Yeah, I'm looking at it now. What's that all about?
It's like a head-to-toe inventory of the patient's body systems. The nurse asks specific questions to get a sense of how each system is working.
So kind of like a screening tool to catch any subtle signs of a problem the patient might not even be aware of?
Exactly. It also helps guide the physical exam, makes it more focused. And keep in mind, while they're doing all this interviewing, nurses are constantly observing.
Oh, right.
They're like detectives, always on the lookout for clues. They're noticing the patient's body language, their overall appearance, how they're moving, all of it.
Looking for those cues.
Yes. Anything that seems out of the ordinary.
And all this information, the observations, the interview findings, it all has to be documented, right?
It does.
Why is documentation so important?
It makes sure everyone on the healthcare team is on the same page. It helps track the patient's progress, and it creates a legal record of the care that was provided.
It's like building this detailed map of the patient's health journey.
Exactly. And with electronic health records, all that info is easily shared and accessible, which is huge.
So we've talked about gathering all this data, but what happens next? How do nurses take it all and make sense of it?
That's where clinical judgment comes in. The ability to analyze everything, look for patterns, make those inferences.
The educated guesses.
Right. And then, this is key, they have to validate those inferences by checking them against other sources of information.
Can you give me an example of how that validation process works?
Sure. One of the sources describes a nurse who noticed a small separation in a patient's surgical wound. Now, she didn't just ignore it. She thought about the possibility of infection, checked the patient's temperature, compared her findings to the normal healing process, and then she talked to the surgeon about her concerns.
So she was gathering more data.
Exactly.
Using her knowledge to guide her actions.
It's a process, constantly refining her understanding of the situation.
And this brings us back to concept mapping, right?
It does.
Where the nurse takes all these different pieces of information
All the data points.
and starts organizing them visually.
To see how it all connects. It helps them see those relationships between different health problems, identify potential complications, and develop a plan that addresses everything, not just one symptom in isolation.
This is so fascinating.
Yeah.
It really shows how much goes into nursing assessment.
It really does. And we haven't even touched on the physical exam yet. There's still so much to cover.
We've covered so much ground already with nursing assessment. It's clear that nurses are, like, master data gatherers, pulling information from everywhere.
Everywhere.
But what's really impressive is how they take all that data and actually turn it into, action.
That's where clinical judgment comes in. That ability to look at all the pieces and get a clear picture of what's going on with the patient, it's what separates the experts from the novices.
One of the journal articles kept mentioning these data cues. What are those exactly?
Think of them like little hints, signals that something might be a little off, something that needs more attention.
Yep.
It could be something like a change in their vital signs, a weird lab result, even just a look on their face or a change in their behavior.
So nurses are trained to be super observant, picking up on those subtle things that most people wouldn't even notice.
Absolutely. And it's not just about seeing the cues, it's about understanding what they could mean. Nurses are always comparing what they see to what they know. Their experience, best practices, all of that.
It's like they have a sixth sense.
Kind of.
They're always on the lookout for potential problems.
Always. That takes time to develop, though. The
Right.
more patients you see, the better you get at recognizing patterns, connecting those dots.
Okay, so let's say a nurse spots one of those red flags, a data cue.
Yeah.
What happens next?
That's when critical thinking and clinical judgment really kick in. You have to think about all the possibilities, the risks, the benefits of different choices. And then you have to make a decision, sometimes with incomplete information.
And all of this is happening under pressure, in real time.
Yep, no time to sit around and overthink it.
Wow. So the assessment data isn't just something that's passively collected. It's actively driving everything that happens next.
Mhm.
It's guiding the diagnosis, the care plan, the treatments, everything.
It all starts with that assessment.
It's a constant cycle too, right?
Yeah,
As the patient's condition changes, as new information comes up, the whole process starts over.
exactly. It never really ends. And, while we've been focused on nursing today, these ideas, being observant, thinking critically, analyzing information carefully, those are valuable skills no matter what you do.
That's such a good point. Whether you're a teacher, a manager, even parent, those skills help you make better decisions.
It's about understanding the situation, gathering the right information, and then using it to guide your actions. It applies everywhere.
So true. Well, I think we've given our listeners a lot to think about today. This deep dive into nursing assessment has been fascinating.
It's a complex process, but so important.
Absolutely.
Yeah.
It all starts with that curiosity, that willingness to look deeper, and a real respect for the patient's individual story.
Couldn't have said it better myself.
Yeah.
So for anyone out there thinking about a career in nursing, embrace those qualities. They'll take you far. And even if you're not planning to be a nurse,
Right.
never underestimate those skills, observation, analysis. They'll serve you well in any field.
What a great takeaway. Thanks for joining us for this deep dive into the world of nursing assessment.
My pleasure.
And to all our listeners, keep those requests coming. We're always excited to explore new topics and help you connect the dots.